Your Health Today. I'm Bev Muendel-Atherstone, and I'm your host. I'm the current chair of Lethbridge Friends of Medicare, which is a non-profit organization that works to ensure that our public health system is here for all of us. Today, we welcome our guest, Gordon Butt. Gordon, have you lived in this area very long?
I've lived in Lethbridge for about 5.5 years.
So you're relatively new here.
Relatively, yes.
Where did you come from?
I came from BC. We lived in Abbotsford before we came here.
So a lot more rain.
A lot less rain here
Yes.
than in Abbotsford, yes.
Yes.
And that's one of the things I like about Lethbridge. I like the sunshine as well.
Oh, that's the lovely thing here, no overcast skies. So did you find a family doctor when you got here?
Yes, I did. My wife and I found the last two available GPs when we first applied at the end of 2019. Yeah.
You needed an operation. Can you tell us what operation you needed and how you knew?
It was a hip replacement. I knew about the same time as COVID, I started having an ache when I was walking. I do a lot of walking, I do a lot of hiking, and that's part of what I do in my retirement. And I didn't want it to affect my capability of doing these things. The aching got worse and worse, and that's when I went to see the doctor, and it started there.
So you moved here in 2019.
Mm-hmm. At the very end.
And that was sort of when this all started, or it started later?
It started in about March of 2020.
But 2020.
Mm-hmm.
And then you noticed this aching in your hip.
That's right, yeah.
And it was aggravated when you walked.
Yeah, well, I only felt it when I walked. If I was sitting, it was okay. Yeah.
And what did your doctor say was wrong?
Well, he ordered an x-ray, and the x-ray came back, and the radiologist who interpreted it decided it was an abnormality in the acetabulum, the knob of the femur.
Knob. Oh, yeah.
But I think, and as a result, the doctor said there's nothing they could do.
Oh.
So I thought, but later on I went to a chiropractor who did an x-ray of both hips, and from that I was able to discern that the one side had a much narrower space between the acetabulum and the joint, meaning that it had worn away, and it was quite a clear difference. So then I went to the Chinook Hospital and went to see a proper orthopedic surgeon, and he confirmed that it was osteoarthritis.
So was that referral from your doctor?
I can't remember. Well, first of all, I went to radiology, and from there I think I was referred to a surgeon who confirmed.
So you must have had a referral to radiology.
Yeah, that would be from my doctor, yeah.
Yes.
Yeah.
So you went through numerous steps to really
Yeah.
find out what was going on.
Yeah.
And it was through your chiropractor that you noticed there was a wearing out.
The chiropractor didn't even mention it. It was, in fact, the opportunity to see both hips, and then I could see the difference. And
You saw it.
Quite distinctively different. It was not something you'd miss. But if you only looked at one hip, then you might not realize how narrow that separation actually was.
So you were aware of this, and the other professionals hadn't seen it?
No, I think, and I'm not an expert obviously, but I think that it was misdiagnosed initially.
Yes.
And so it went missed, which is surprising because it's an extremely common condition, as you know.
So was that arthritis, the reason it had worn away?
Osteoarthritis was
Osteoarthritis. That was the diagnosis?
Yes.
Okay, and then were you put on a waiting list for?
Yes, I went to see the surgeon, and he confirmed everything and said, yes, we'll get the operation done as soon as we can. And then later on I found that I would have to wait at that time, which was probably in early 2021, that the delay would be about 6 months.
Okay. And was that okay? 6 months?
Well, no, I phoned probably every 4 or 5 months, and every time I phoned, the delay was larger. So initially it was 6 months, and then 3 months later it was 8 months, and 3 months after that it was 12 months. So if extending that relationship, I would never get a hip replacement. Now, to be fair, that was COVID time as well, so that very much complicated the scheduling of operations.
So that was very difficult. You finally get the diagnosis, you finally find out what's happening, and you see the surgeon. They say you can come. 6 months doesn't sound bad at all. And but then it keeps getting longer and a longer
That's
wait
right,
time.
yeah.
So at what point did you decide you're just not going to wait any longer?
When I phoned, and after having waited about 6 or 9 months and found out that the delay was even longer, that's when I decided I didn't want to live with this condition anymore. It was impacting what I did for recreation, my hobby, and I thought to myself, I need to get something done about this.
Okay, so you decided to get something done, and about how long had you been waiting by that time?
Well, let's say a good 12 months.
A good year, a good year. Okay, and then what did you decide to do? How did you figure that out?
Well, I went to Google and said, where can I get a hip operation? And a number of options. There was an option in the United States, in Phoenix, for example. The total cost was about $40,000 US, which was more than I wanted to pay. Then I could also get it done in Ontario. And this is quite surprising. It was possible to get the operation done in Calgary, but not if you were an Albertan. You had to be out of province in order to do that.
Well, that's very interesting.
Yeah.
So there were possibilities in Calgary, but not if you're an Albertan. So you
That's
couldn't
correct.
come from Lethbridge and get an operation in Calgary, even though they had the doctors and the equipment, the operating room.
That's my understanding of it. Now, I would have had to pay the full rate, which again was in the order of $40,000.
40,000. Yeah, that's quite a bit.
It is a lot of money, yeah.
So
Especially when
that's-
you're a retiree with a fixed sum that has to keep us going for the next, I don't know, 20, 30 years.
So when you looked at the operation cost in the U.S., that was 40,000 U.S. That would
Yes.
be 50 odd or almost
It
60,000
would have been
Canadian.
totally 50,000.
Yeah, but in Toronto, you said you also looked in Toronto, Ontario.
It was in Ontario. I don't remember if it was in Toronto or not.
Okay, and did you look into that one to see? how long
Yeah, I
it-
phoned them up and asked them about it, and they confirmed it would be in the order of $40,000. But they would have been able to do it quite quickly,
Quickly.
within a month or so, I think.
Oh, so that.
And also the one in Phoenix, I could probably schedule it within about 3 weeks.
So those were quick. You'd pay quite a bit of money.
But they were expensive, so I kept looking, and I came across an organization called Nord Orthopedics.
Nord Orthopedics.
And this was based in Lithuania, in a town called Kaunas.
Kaunas.
The second biggest city. I think it's the second biggest city in Lithuania. Yeah, so I followed up with that.
How did you get in touch with them?
Email.
So you got in touch with this Lithuanian. Is that the facilitator for this process, or is that the medical?
It's a clinic.
That's
It's
clinic.
a private clinic,
Okay.
and they specialize in operations similar to hip operations. They did knees as well. I got a quote for about 7,600 euros, which translated to about $10,500 Canadian. And this made it feasible for me to look further into this option.
Well, that's quite a bit of difference if you're looking at 10,000 versus looking at 40,000 in Ontario,
Yeah.
or 55,000 down in Phoenix.
Yes.
Okay. So then, what was your next step?
Well, I continued to correspond with Lithuania. I got onto their website, and they also had a Facebook page, and there were a lot of people who had done the operation and were very highly satisfied with it, and were actually extremely lauding of the care, the standard of care, and independent reviews were also very, very positive. And it turns out that hundreds, if not thousands, of people, mainly from the UK, Ireland, and Canada, were coming to this clinic for their operations. So I felt some degree of comfort. That's when I decided to go ahead and make the trip.
So that was a great deal of research on your part, looking online, finding different places, comparing them. The two things were that you wanted as low cost as possible, and you wanted good care and quickly.
Yes, I wanted to make sure that it was a good standard, because you're taking a risk there, obviously. But in retrospect, there was no reason to be particularly concerned. It was a large number of very positive reviews that gave me comfort.
Okay, so how did you prepare for this? What did you need to do? Did you have to send them your radiology reports or your x-rays?
Yes, good question,
Your
yes.
medical
Yeah,
information?
they wanted all the medical information. They wanted x-rays. That's pretty much it, though. They almost immediately replied and says, you're a good candidate for this operation, and they wanted to make sure I was healthy. They wanted, when I arrived in Kaunas, one of the first things I had to do was a COVID test, which I did have to pay for extra, but yeah, so they did some due diligence on their part, and I did some on my part, but it turned out to be a good fit.
So, since it was during the COVID time, did you have to have your COVID shots? Had you had your COVID vaccinations?
I don't know if they checked the vaccination record. I can't remember right, but I had to have a test done 2 days before the operation.
Just to ensure, because even with the vaccinations, you can still get COVID. You get a light case, but okay. So they checked you out. So then you've got to pay over 10,000 Canadian dollars for the surgery to this Nord
Orthopedics.
Nord Orthopedics.
Yeah.
And but then you have to get there, and you have to fly there and fly back. And
well, getting there was no problem. My wife Lorraine came with me, so the two of us went out, and we booked our hotel, and it was quite a comfortable hotel, and yeah, coming back was a little bit more difficult because I just had the operation and I was on crutches, but the airlines were super at accommodating me as a disabled person, and I also got more appreciation for what it's been like to be a disabled person.
Did they have wheelchairs for you at the very?
Yes, and they even pushed me out onto the
tarmac.
Well, in one case, yeah, they had a special lift. So I thought the airlines were doing a great job of.
Well, that's wonderful to hear.
Yeah,
that's very wonderful to hear. So, what date did you actually leave Canada?
It was in April of 2022. I don't remember the exact day.
Yes.
We went there a little early so we can do the COVID test, but also so we could see something of the town.
Yes.
Because I like to travel, and so I sort of combined the operation with a little bit of travel as a tourist, and it was worthwhile. It was an interesting place.
Yeah, Lithuania, the three Baltic countries are very beautiful, very ancient.
I can name each of the three, and I can tell you where they are on a map now, which I couldn't do before.
Very good, very good. Then you arrive, and what do you do from there?
They picked us up at the airport. They took us to our hotel. We did some preliminary examinations. We had some time to walk around and enjoy the town. And then I was scheduled for the operation only about 3 days after arrival. And then I had the operation.
How long was it from the time you booked the operation until you got the operation?
About 3 weeks.
3 weeks. So that was similar to what the hospital in Phoenix had said.
Yeah.
About 3 weeks.
Yeah. I might have been able to do it shorter than that, but we wanted a bit more time to get ready.
So you could pretty well pick the date that you wanted, as long as you had that interim time of about 3 weeks.
The operation itself was part of like an automation. They would arrange for 3 people to be readied in their operating rooms. After preparation, the surgeon would come and do the operation. Meanwhile, the other 2 were being prepped, and then he'd move on to the second one. So they were able to handle quite a large number of people very, very efficiently.
So they're doing 3 people sort of at the same time. The other 2 are in prep, and you're getting operated on. And
that's right, like being a rotation, an automation line almost. Like I think about Henry Ford, except it's.
And you're going down the assembly line.
That's right. Yeah.
Okay, so you had the operation. You get the new hip. Then what happens? How long do you stay in hospital?
Yeah, that's a good question. It was just overnight. So 1 night in the hospital.
1 night.
And then I went back to the hotel, but then I had arranged for 7 days to have rehab, which they very, very strongly recommended, and in retrospect was a good plan. And that's where I met with a physiotherapist, all of whom, by the way, can speak in English quite well.
Yes, I was going to ask about the language barrier.
Because I only spoke 10 words of Lithuanian, and I probably mispronounced those. So it was very professional, very efficient, and it was very helpful. After the 2nd day, I could walk.
Wow.
Which is a bit surprising, even up and downstairs.
Oh, with the physio.
With the physio, they encouraged us to walk, and they also showed us exercises to do to help repair the muscles.
So the second day, you mean you were operated on, you went home, that was
To the hotel.
that was the first day,
Yeah.
and then the next day you're able to walk.
Mm-hmm. Well, I say that guardedly. I mean, yeah, I can walk, but I couldn't run, or I walked very gingerly.
Gingerly, yes.
Yeah.
And how was the pain following the operation?
Very, very limited indeed.
So did you have anyone guiding you through this process?
Well, not guiding me. There was lots of help, lots of information. There was no problem with there was never a time when I didn't know what was going to happen. But having my wife with me was a really big bonus. So I was very grateful to her for coming with me.
Yes, I can imagine she must have had a lot to do to help you with this process.
Well, I'd like to think it wasn't all that much, but it was great having her with me, yeah, for sure.
And where was the surgery? Was it in a hospital or was it in a clinic?
It was in a clinic, a private clinic.
So
They
this
had
is
whole
a
building.
private clinic.
Yeah, a private clinic, right. Now, they also did public, Lithuania, like Canada, has a public health system, but there's a very long wait
Oh,
for it, unless you're like me and can afford to have a, so they had one section for private, mainly overseas people,
yes.
and then another section for Lithuanians.
And the Lithuanians have to wait longer.
That's my understanding. You might want to fact check that, because that was only a taxi driver that told me that.
Ah, okay. So was the physiotherapy at the same clinic or somewhere else?
Mm-hmm.
It was at the same clinic. And was that part of the $10,000 parcel?
No, that was an additional $700.
$700 for 7 days.
For 7 days.
And how long was each session?
It was an hour.
Oh,
I was quite satisfied. In retrospect, I think it was a very big part of my recovery. And it was very, very well reviewed. Yeah.
so they give you exercises to do during the day?
Yeah.
And you followed those exercises? Were you religious about following them?
I was quite religious, yes, it was.
So that's part of what the recovery was, is that
Yeah.
you really followed them to a T and
I did.
and learned how to do it, and then
Mm-hmm.
you could see the benefit, you could feel the benefit.
Well, it's always hard to know, because I can't really compare it with anyone else. But it all seemed very logical to me. The exercises were all designed to gradually strengthen the muscles in the hip. So it was a good experience.
That sounds fabulous. And so it was one physiotherapist that you saw, or did you see
There were
a variety?
two. The senior one apparently had a very high, very good reputation, from what I understood.
Now, the healthcare staff that you had in the hospital, you had the surgeon.
Mm-hmm.
Did you have other nurses, other people working with you?
Sure, yeah.
And what was that like?
They were all excellent. Most of them could speak English, and very good English too. And they were all solicitous, and it was extremely comfortable.
So, were there any problems following surgery? Was there any problems with bleeding or anything like that? You had no problems, as I understand it.
Excuse me. It was a small problem in that I had very high expectations of myself, and so I overdid it from time to time, resulting in some aching.
Was it, you mean you overdid the physio?
I overdid the physio, yeah.
Oh, so you weren't just religious about the physio, you overdid it a bit.
I was, but I was a bit, yes. Well, I walked, for example, I had crutches, and I walked all over town. And there were times when I probably thought, uh-oh, I've done too much.
Did they give you a recommendation about how much you should walk?
No, they said just take it easy.
Oh,
So that was entirely on me. I was just sort of,
so you didn't understand what that word "take it easy" meant.
no.
Your understanding and their understanding was different.
You know what it's like. We all think we're Supermen, right? You know, we think we can do, I can do that. So, but it was a minor issue. And yeah, the recovery, when I came back to Canada, I started doing rehab with a local firm.
Oh,
And that was helpful too.
also a physio? Also physiotherapy?
Yes, yes.
And that was private?
That was private, yeah.
You couldn't get public physiotherapy following it?
I'm sorry, it was partly covered by Blue Cross,
Covered by
so
Blue
it wasn't
Cross.
very expensive, and it was very good.
So that was private. Your doctor couldn't send you for a physio because you had
I didn't
the
go through a
surgery out
doctor.
of-
I just went through a
You just-
physio firm.
Okay.
Yeah.
Okay. Now, what were you hoping your mobility would be like after the surgery?
Well, I was hoping I would gradually be able to walk pain-free.
Okay. And has that happened?
It worked very well. I haven't had any problems in the what, three years now since it's 7. I've had no problem at all.
And your legs, do you feel your legs are the same length, that you don't
Yeah.
have any
Yeah.
difficulties with being...
I can walk in a straight line.
Mhm.
If one leg was longer, I'd be walking in circles. But no, it worked out really well, actually. Yeah.
You're not
No
limping
complaints.
or anything like that? No. Okay, now you mentioned, I want to ask you about your mental health. So before the surgery, before you even went through this whole process,
Mhm.
what was it like when you started having the pain? What did you feel emotionally, mentally, when you started with this pain?
Well, I was not happy that I had to curtail my activities. I was not happy that I couldn't hike like I used to. That sometimes I found walking difficult. Yeah, I was not very happy about it, and I was very disappointed that there was no solution in the short term.
So you're disappointed and frustrated?
Mm-hmm. Mm-hmm.
And then when the time kept getting stretched out, you'd had longer and longer wait times?
Yes, that's when I started thinking, if the public health system can't help me, then it's up to me now to see what else I can do.
And you're kind of a take charge person, are you, Gordon?
Yeah, not especially, no.
Not especially.
No, not really.
No, but this was so frustrating, and you're thinking, this is,
Mhm.
you know, if I extend this out and they keep elongating the time, you know, ultimately I'll never get this operation. So
Yeah, you know, Bev, I'm like a lot of people at my age. We're retired, but we're still active. And what we have left is time. And we want to fill our time as effectively as we can. And if we can't do the things we want to do, then that's going against the whole point of being retired. And I felt I can't waste that time.
all right, and then you went ahead. Now you've had the surgery. It's been 2.5 years, just over.
No, just over 2 years, yeah.
Just over 2. Was it 2022?
It was 2022. No, did I say 2 years? It's 3 years.
It's 3 years.
Yeah.
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 So it's just over 3 years.
Mm-hmm.
You had physiotherapy there for a week. You came back. You had some more physiotherapy.
Mm-hmm.
How much longer did you have?
Oh, I did it for about 2 months.
2 months.
Yeah.
So in total, just a little over 2 months physiotherapy.
Mm-hmm.
And what would you say your quality of walking is now? Was it as good as before?
It's undiminished.
Undiminished.
Undiminished. I don't run anymore. I've given up running, but that was for other reasons. I got sore knees.
Okay, so the hip problem
It's gone.
is gone, and now you've got a new problem, knees.
That's 40 years in coming. My work before I retired involved a lot of hiking through rough terrain, and
Yes.
I think the accumulated stress on my knees is now coming to fruition. It's not a problem now, but I think in 5 years it probably will be.
So you can tell the way it's starting to hurt,
It aches a bit, yeah.
that this is the beginning of something.
Yeah. Well, it's not the beginning. It's more like it's the effect of a lifetime of heavy stress on my knees.
Now you're feeling it.
Yeah.
So now that you've had this experience, what would you do if you needed to if you felt the pain was getting so excruciating that you needed a knee operation?
I would go and try to get it done locally through AHS.
Okay. And if you had the same problems as before?
If I had to wait a long time, I would go. I would unreservedly go back to Nord Orthopedic
To Lithuania.
in Lithuania. Yeah.
And would you have you recommended this to friends?
Mhm.
You have. You
Yeah.
have. Yes, and I've heard of others who are going to exactly Lithuania for this
Mhm.
operation.
This is a particularly good clinic. It's very well known. Incidentally, while I was there, I met quite a few Brits
Yes.
and Irishmen, as well as a few other Canadians. And those three countries make up a big part of the clientele of the clinic.
Well, that sounds like the clinic is doing well, but if, like the taxi driver told you, that the public in Lithuania aren't able to access the public care, they're having the same problems as we are here.
Yes, from what I understand, Canada is not alone in that issue.
Yes. Is there anything else that we may have missed or that you would like to share with viewers? Because I know that there are many people who are suffering from hip and other joint replacements and are trying to figure out what to do, and the wait times are very long because there aren't enough anesthetists and we don't have enough doctors.
Yeah.
The hospitals do have surgical wards, but there don't seem to be enough healthcare staff to man them. So what would you like to say?
I understand these problems, and I understand that we are in a position that we could afford to spend that much money in order to have a full, unrestricted lifestyle. And I understand that there are Canadians who can't afford that. So, yeah, it's a real problem. I think it's important to be aware of this, and I don't know what the solution is. I mean, there are a lot of medical experts in the country that are in a much better position than me. But I think that people should be aware that this is an issue that's affecting our quality of life. And it's not much consolation to know that the NHS in England is going through the same thing and they have similar wait times. It's not much consolation, but I think Canadians may sometimes be a bit unaware, for example, that we have these problems, especially if you've never had a problem. You might not be aware that that Canada rates in terms of wait times is worse than quite a few of the developed countries. Not the worst, but it's not the best either.
Yes, and that's quite a statement about a country that's part of the G7 and is really quite a rich country.
Right. And I don't want to speculate on the causes because I don't really know enough about it.
Well, I thank you very much for coming in and sharing your complex and interesting story, and to be able to hear from your point of view what it was like to get health care in another country,
Yes.
to get surgical care, and to manage to get good care and come home and to feel just as fine as you did before this all started.
Yes. And like you said, I'm happy recommending or referring other people to this particular clinic, but I wouldn't say that's a carte blanche to any kind of medical tourist in other parts of the world. You have to do your own research on that.
Yes, and you really had as your number one priorities the wait time and the cost and the care, the quality of care.
Yeah,
so
that's
you
right.
don't want to sacrifice any of that.
That's absolutely right.
And you found something that fit your budget and fit your timeline, and obviously you had a very good outcome.
I did, yes.
Thank you very much, Gordon.
Yeah, thank you.
Thank you.